There are a couple different ways to assess the girth of the limb. I'm going to show you probably the most common way, and then we're going to show you a way that you can do it, which is great and effective. It's just time consuming and a little messy. Okay? So, first thing I'm going to show you to do is measure the upper extremity. Now, we measure girth in a couple of different ways, so you guys want to come a little closer if you want to measure this side. Okay. What I'm going to show you on the upper extremity, you can do on the lower extremity. In the last class, I did the lower extremity. This class, I'm going to do the upper extremity, so you guys can help each other. Okay. Normally, if it's lymphedema or venous insufficiency, I'm going to measure the entire limb. Okay. How close my measurements are of the limb depends upon how severe it is. If she is really severe, I'm going to put my measurements much closer. If it's not that severe, my measurements may be a little further apart. How you determine measurements as a PTA is you look and see how the PT did it on the eval. We want to be consistent. Just like I told you, if they did a numeric pain rating scale, you're going to do a numeric pain rating scale. If they did an oswestern, you're going to do an oswestern. If I use my styloid process here, you're going to use your styloid process here. Okay, radial ulnar. Okay, they're going to tell you which one that they're going to use. Okay, and then if they're going to go up every 5 inches, you're going to go up every 5 inches. Okay, now the best comparison of her left arm is compared to her right arm. Okay, so if we're taking measurements, and we typically don't take measurements every treatment session, we typically take measurements once a week or every 2 weeks, every so many visits, because it is time consuming to do this. And usually one session isn't going to show it, it's multiple sessions that are going to show it. Okay, so I'm going to measure her left arm today. I'd also measure her right arm, because she could have saw the PT first thing in the morning after she got out of bed and not had hardly any swelling in her arm. Today she's seeing us after she worked 8 hours, okay, and she could have more swelling in her arm. So you always want to compare apples to apples. Okay. All right. So first thing I'm going to do is I'm going to find, and I'm going to use her ulna over here. And I'm going to find her styloid process. Now this gets a little tricky because people always go, well, are you on it or are you below it? It shouldn't matter as long as you're measuring the other arm, because you're doing it the same on both arms. Okay. So then I'm going to take my tape measure. Okay, now this is a Tammy Marson trick. Okay, I let my tape measure hang over like that so my tension is correct. Okay, I have my patient's arm relaxed. If she was to hold her arm up for me while I do that, my measurements would change. Okay, so you want them to put their arm in a relaxed position, and you want to measure this arm exactly like you do the other arm. Okay, now if you don't know how to read a tape measure, you need to see somebody that does. Okay, we'd be more than happy. We might make fun of you, but we'd be more than happy. I'm just teasing. We'd be more than happy to show you how to read a tape measure. We wouldn't do it to your face. Show you how to use a tape measure. Okay, the problem that some people make sometimes is they'll put it on here and they'll go, it's 5 centimeters. It's not 5 centimeters. It's 15 centimeters. Okay, that's what I'll see somebody make who are novice at this. They're doing this for the first time, is they won't take time to read the tape measure. So practice doing this and then you'll get it. Okay, so my girth at her ulnar radius is 15.5 centimeters. Then what I'm going to do, and I usually mark on the skin. You guys have a pin marker in your bag. That's what you use this for, or use a washable Crayola marker. Okay, and then I'm going to go up the skin and I say, okay, I'm going to go up 10 centimeters. That's just what I picked. And then I'm going to bring my tape measure back around. Okay, and I'm going to let it hang, and I'm going to go, well, that's 19.4 centimeters. Okay, and I'm going to work up my arm as high as I need to. If she only has swelling in the lower part of the arm, I'm probably stopping at the elbow. If she has swelling all the way to the armpit, I'm going to go all the way up to the armpit. Okay, and again, we don't do that every treatment session. You may just do one if you want to compare. You may go, well, she looks the largest in the calf today, so I'm going to measure around the calf. And then I'm going to measure the other side. I'm going to do compression therapy and see if it makes a difference. But we typically don't do the entire limb every treatment session. It's typically something that's only done at progress time, which is about every 2 weeks, okay, or 8th visit and see if that's going on. Now, a figure 8 we can do on any joint. Okay, a figure 8 here, I'm going to show you on the elbow, but you could easily do it on the ankle too. Okay, so I'm going to show you on the elbow here. So I start up at the top. I'm going to come down and around. I'm going to tell her just to let her arm hang, and I'm going to come up and do my figure 8 measurement. I'm reading where the 0 right there meets my tape coming around. So for me that is 50, no, not 4 too high there. 58.4. Okay, now we can do the same thing on the ankle. Okay, so I want you guys to practice on that. If she just had swelling at her elbow joint and she didn't have it in her whole hand and I wanted to just do her elbow, I would find myself a bony landmark at her elbow, and then I would take it at that landmark, and then I would go above and below that landmark. I may say I'm going 1 inch above or 1 inch below. Okay, that's one way we assess edema. Okay, girth, and we're going to show you volumetrics in a few minutes. Okay, after we get you guys going here for a minute. Okay, now if she had lymphedema or she had some type of venous insufficiency, the compression pump may be ideal. Before I put this on her, I would take her blood pressure. What does your blood pressure normally run? 120/80. Okay, so I'm going to be safe and just not go above 70. That's just it. I'm going to be safe. I would normally take it, but for time's sake, I'm not going to do it today. Okay, I would expect you guys to take it. And then what I'm going to do is I'm going to check my sensation on both sides, and I'm going to make sure my skin's intact. Okay, I'm going to do my light touch where I'm going to apply the modalities. I'm going to apply my sensation. Then what I'm going to do, see if there's any of that stockinette around here. Let me grab one. I think the other class. Hang on 1 second.
You got all that?
No, that is called chicken scratch. Melissa's on shorthand. I'll have to go back and listen to the tape and write it.
That's what that meant.
Yeah. Oh.
I spent a lot of time trying to figure out what.
I mean, that's bad. That's just so ugly. I wish I had clear hair on. That's just not going to happen.
My chicken scratch in person. So
No, they told me in school, just stop. Just go back to print. Did they really? Yeah. This is before. That's before you had computers and you had to write papers. They please just stop. Just write print. I got extra credit for like practicing writing my alphabet.
I'm not going to put her on her. So typically what we do is we apply a stockinette to it. This is dirty. Normally these are just a one-time use. We throw it, but for here purposes we throw them in the washing machine and we wash them and we lay them flat to dry, just for us. But what you're going to do is you're going to put this on the extremity and you're going to make sure there's no wrinkles. This comes in different sizes. This would be too big for her arm. You see how she would get lost in there and get wrinkles. This is really more for our lower extremity, okay? Because it's been on somebody else, I'm not doing it. The most common way is to put a stockinette on. However, you can do it without it. You're just going to want to clean the sleeve. Now, if I had a wound, I would want to make sure that I had it dressed appropriately, because if I put pressure on it, it's going to start weeping everywhere. Okay, that would really contaminate that sleeve. Okay, all right. So the next thing I'm going to do, okay, is I'm going to then put my sleeve on her. Okay, so I'm going to have her lift her arm up. Now, we know that elevation with compression is ideal, right? Okay, so the other thing I'm going to do is I'm also going to elevate her arm up. Okay, now this is the fanciest machine I've ever seen for compression therapy. Okay, this has all the bells and whistles. It's like driving a car and go, well, I didn't know it could do that. And you go, I want one of those, because you didn't know it could do that. Okay, so this one has everything on it. Okay, this one you can change the size of it. It doesn't really matter because pressure is pressure. It doesn't matter if I have it on the biggest spot or the smaller spot. Okay, go ahead and lift your arm up. I'm being lazy. I'm tired. And put your arm back down. Okay, as long as I have it at her chest height, then I probably could go one more pillow up. Okay, so that it stays elevated. Okay, now on this machine here, okay, this knob just pushes in. Okay, and it locks in place. Now this machine here, you do not set the duty cycle. It's set within the machine. Okay, you don't set it on this machine. It has a distal pressure, a medial pressure, and a proximal pressure. It's never going to let your distal be lower than the other two. It's not going to do it. It will automatically change the other two. So if I turn this one up, then these two are automatically going to change. Okay, it's as simple as that, because it's a safety mechanism. It's not going to let it happen. Okay, this pump has 10 chambers. Okay, this is fancy. Okay, this pump has 10 chambers, and this pump fills up very quickly. Okay, you'll see that. So if you were in a clinic where you were doing a lot of compression therapy, and it was a specialized clinic where you were doing lymphedema training, this is the pump you would want because of efficiency. Okay, because it's going to pump up quick, and it's also heavy duty. This was the last one that we got. We have these other smaller ones that are right here. The problem is with students, they were turning them on and off frequently because everybody wanted to try it, and it was putting a short in the button. So we went to something heavier duty, so our machine could tolerate your guys' heavy use. Okay, that's why we have the heavy duty one here. On this machine, it's pretty simple. As I would tell her, I would say, Kavita, you should be able to wiggle your fingers when the pressure comes on. Okay, it's going to feel snug, but it shouldn't be uncomfortable. Okay, if it's uncomfortable, you let me know. I'm going to give you a bell. Okay, and then you're going to ring it. Okay, if it gets uncomfortable. So then I'm going to hit start. Okay, and this machine will fill it fast. We'll do the other one so you can see the difference and see how it starts distal. And it almost looks as if it's crawling up like a snake. Isn't that kind of cool? Okay, and it's just going to crawl all the way up. That's what we call sequential. Okay, she's going to get the pressure the same, but she's going to call sequential. Now, if you look at this machine here, it's set at 60, 30, 50, 45. Okay, now it goes out quick, and then it's going to come back on. Okay, so now it went down. Okay, and in theory, if you think about it, it's almost kind of like having a massage. Okay, it's going to go from a distal to a proximal. Okay, so it's 60, 50, and 50. Okay, and then after it fills, it's going to hold for so many seconds, and then it's going to let it back out, and then it's going to start the process all over again. Okay, now this machine, they have also, because of lymphedema, they actually have a sleeve that goes around the trunk, because we have to clear the trunk, not just the arm, for lymphedema, which we'll go more into over the summer. And so this particular machine actually also has compression therapy that goes around the trunk, okay, for this machine. Okay?
Is that what those other two hoses are for?
I don't know if those two hoses go to that, or if you could have a sleeve that has additional chambers. I think there's a top piece that zips onto that up there, and I think you can have additional chambers with it.
How's it feel,
think
Kavita?
so.
Is it weird?
Not really.
Not really.
It's like you're in hydro massage bed.
Yep.
It seems like that.
Is it cold? Is it the cold air?
No, but we have one that does. We'll show you that in just a little bit. Okay, this machine we would leave on her if she had lymphedema. The most she'd leave on is an hour, and in theory she could do it 5 days a week, 5 to 7 days a week. If it was a venous insufficiency, you could leave it on for up to 4 to 5 hours. Okay, nobody's staying in a clinic that long. I don't want to give you guys the impression that they're leaving here and staying in the clinic that long. It's not happening. Most patients that are coming in, they're doing this probably as an adjunct to other treatments that they're doing, maybe to help soften the tissue, to start the process along before they do some manual therapy or something. So this not getting it for hours on end. It is an untimed charge. We can bill for this, but it's untimed. Okay, so just because, if I keep her on this for 4 hours or keep her on here for 10 minutes, I'm getting the same reimbursement charge. Okay, it's an untimed charge. So before I leave the room, I want it to have gone to one complete cycle, and on this machine, that's pretty quick. Okay, you'll see a difference with the other one. So I want it to have gone to one complete cycle. I give her a call bell, and I tell her if she needs anything, she rings it. I'm leaving her on here for more than an hour. At an hour, safety-wise, I should shut it off. I should unzip it. I should look at her skin, make sure she's not getting any red areas. I should offer if she wants to go to the bathroom. And if she doesn't, then I'd zip it back up and I'd start it again if I'm going longer. Okay? But that's not the norm. Yes, ma'am.
How do you know, like, where to zip it? Because I personally, I would have zipped it, like, the tightest one.
You could.
know?
You could. It wouldn't have mattered. It would not have mattered.
So it still blows up to the same amount of pressure.
That's right.
According to, okay.
And you could, when somebody does this in a minute, you can change it and put it at the other one, and it should not be a
Okay.
difference. In my opinion, it's just physics behind it. It should be a difference with it.
Okay.
Yeah.
So like all three of those numbers are 55 now across the board, is that what you're looking for?
Well, it's not what you're looking for. This is 55, and see it goes up to 50, and now see that's 60, and then this number over here is going to be less because it's distal, medial, proximal, and that's 45. So it's 60, 55, 50, okay? And that's what you would naturally suspect, that it's going to be.
See, now it's
that.
all 55.
But it's going to go down. It's going to
Okay.
go down, and so it stays that for a brief second, and then it's going to go down. Yes. All right. It's not going to let you turn the distal up higher. It's not, and I'm not going to let you turn the medium or the top number up higher than the distal. It's not going to happen. Okay. Okay. So then I'm going to hit stop. Okay. Good. So why don't a couple of you stay here and try this machine?